I am going to start recording. Okay, good. Okay, so welcome. My name is Jolene Shannon. In the class, you'll see Diana Shannon because Diana is my first name, but I go by Jolene. So my Zoom says Jolene. It's really confusing. So I sign everything as Diana because it says that in my class. My name is Diana Jolene Shannon. So that's just to clear that one up right out of the way. I'm going to just tell you a little bit about myself, and then I'm going to go over the course and this week 1, and also go over our assignment. So my name is Jolene Shannon. I've been with Herzing for about 5 years. I teach for a few other colleges as well in their online allied health programs. I really enjoy it, so I work full-time from home now doing that. I have over 11 years of experience in clinical healthcare. So I've worked in hospital systems, I've worked for internal medicine, pediatrics, women's care. I worked in labor and delivery for a little bit. I've kind of seen it all and done it all. So I've got lots of experience in the healthcare field. And I started teaching about 11 years ago, and now I do that full-time from home. So I've really enjoyed teaching. I really feel like it's where I'm meant to be. I love working in healthcare and I miss patients and seeing people, but I really enjoy these live sessions because I get to talk with y'all. So that's exciting. I live in Southwest Michigan. I'm married and we have 6 children, so 3 boys and 3 girls. My oldest son is 24. So he's kind of grown and gone, but he comes back quite a bit. He's finishing up at Western Michigan University. My second oldest son is going to be 22 in a couple of months, and he's living at home right now and just working. He hasn't decided what he wants to do as far as college. And then I have a 19-year-old daughter who's at Grand Valley State University. So she is home right now because of all the stuff that's going on. But she just finished up online for her first year, so she did real well. And then I have 2 seniors in high school. So my youngest son is a senior and he is just finishing up his senior year. And then my stepdaughter, who I count as my own, is also a senior and she's finishing up as well. And then my youngest one is going to be 10 in a couple weeks. So she's in the 4th grade right now. She's actually doing a Zoom meeting as well for her class. So that's kind of crazy. I was like, okay, you go do your Zoom meeting and I'll do mine. So she's doing well with school at home, but she misses her friends for sure. So as you can tell, we have a big age gap between our youngest and our other 5 that are pretty much all adults. So she was kind of our surprise. So we live in Southwest Michigan. I work from home, so this transition with COVID and everybody having to be at home didn't really affect me much other than my kids all had to come home to do their schoolwork. So it's kind of been a little stressful trying to do work with all of the kids at home as well. So I'm sure you guys are going through some version of that, trying to figure out work or kids. So if you need anything, please let me know. Okay, let me know a little bit about you guys since there's just 2 of you here. Which one of you wants to go first? You want to go first? Is it Makia?
No, that's my daughter's Zoom. I'm Lakeisha. My daughter's been using Zoom for school, so her name is on there.
Okay, great. Okay, well, let me know a little bit about you.
Well, I'm a mom of 4, and this is in December. I'll be graduating. I'm in the medical administration program.
Oh,
so
wonderful.
It's been a little challenging with the kids being at home and trying to do schoolwork and then helping them do their schoolwork. So it's been a little challenging, but we've been making it and just trying to stay safe.
Yes, definitely. Well, that's great. Only a few more months to go.
Yes, ma'am.
You are in the finish line. That's great. Okay. You can go ahead and unmute and tell us a little bit about you too, if you like.
Wow, that's a lot. I'm a mother of 2. I have a boy and a girl. They're 8 and 9. My daughter, she's actually on the computer now in class now. I live in Atlanta, Georgia. I actually was supposed to be graduating in December as well, but I just pushed it back to April. So lower my case study for me because I work full time. I am actually a CNA, so I work in home care
Okay.
Monday through Saturday. I have different kind of clients and patients, so I'm in there with the coronavirus, but I try to stay as clean as possible, keep them as clean
Oh
and
yeah.
healthy as possible. What else? Yeah, that's about it. I'm just ready to finish school to finish,
Yeah.
so I can
Well, you're
get a
almost to
good
the
break
finish
and a
line
vacation.
also.
Vacation. I need a vacation from school. I need a vacation, just a good 3 months. I'll be okay.
I bet, yes. That, especially the end, gets really stressful, and all you want to do is be done.
Yes.
Oh yeah. Okay, so I'm going to have you guys mute yourselves so we won't have any background noise, and I'm going to go ahead and get started. So I'm going to share my screen. Let's see. Okay, are you guys able to see my screen?
Yes.
Okay, perfect. Okay, I have it set in student view, so it kind of shows what you guys would see instead of my screen, because mine has a lot more stuff on it because I'm an instructor. Okay, so you'll see the home page just like your other courses. I teach 2 sections of pathophysiology and pharmacology, so if this isn't your section, don't panic. I just picked one of them. But this is our homepage, so this has everything that you need to know as far as our grading scale, makeup policies. You can get to your syllabus from here. There's a quick outline of everything that you're going to need to know. So just make sure you check that out. Over here, it should have announcements. This little megaphone thing means announcements, so make sure you check those. I put our live session recordings there. I put our Monday morning announcements as far as due dates and what you have to do. So if we click on announcements, you'll see that I have our hello, welcome to week 1. It's got everything you need to know for the week. It's got due dates. It also always has my office hours and phone number. So if you need to reach me, I hold lengthy office hours just because I teach for so many other schools as well. So I'm available Monday through Friday from 8 a.m. to 5 p.m. Eastern time. You can call me, text me, you can email me through the classroom, whatever you would like to do. If it's after hours or on the weekend and you want to get together, just send me an email and let me know when you're available, and I can totally make that work. So just make sure you utilize that. I'm here to help you succeed. So make sure you reach out to me. I always have some additional resources for discussions that you can check out. There's always information in the Monday morning announcements for the Writing Center if you need help with writing papers or research strategies or APA formatting or anything like that. Make sure that you utilize this. Alexis is a great tutoring and writing center instructor, so please reach out to her. Her phone number is here, her email is here. Make sure you utilize that as well. Our syllabus is here. It's really straightforward. It's got our due dates and everything that you're going to be doing for the course. So if you need kind of an overview of that, check out the syllabus. Okay, so let's look at our modules. So the first section has an introduction to the course. It talks about, probably similar to your other classes, discussion board opportunities, our price of success model. It talks about making sure how to construct your responses, and you want to use like a word processing program like Word when you're doing your responses to make sure that it checks for grammar and spelling, because I do grade on that for your discussions. Now, I don't want you to turn in your discussions in a Word document. You want to put it in the discussion area like normal, but while you're writing it up, you can do it in Word and it can tell you if you've misspelled anything, and then you can just copy it and paste it into your discussion board. But make sure you check for spelling and grammar. Okay. There's also information here about the HDX, which is the kind of text, virtual text thing that we use for our classroom. My information is here. I just went over that with you, kind of my background and things, but if you want to check that out, it's here, as well as my office hours and things like that. So make sure you utilize that. My phone number's there as well. So my phone number's kind of everywhere. So please make sure you use it if you need it. Okay, there's also some library resources here, so you can utilize that as well. So every week we have Unit 1. It's called, instead of Week 1, it's called Unit 1. We have an introduction, so make sure you go into that first because it kind of sets up the week for us. It tells us what we are learning about. It kind of introduces the topic of the week. The learning content is here that you can click on, which is reading and things that you can do.
I have a question.
Sure.
I did go through because I did do this Saturday. I did go through it in the learning content, and I see that it has 200 drugs that we have.
Mm-hmm.
So my question was, when I went in there to just print it off, like just to have that as my notes, it wouldn't let me just print it off like separately. I had to actually go in there separately, but it wouldn't allow me to. So my question was, I previously attended Virginia College before they shut down. And my instructor gave me the list of 200 drugs, but I don't know if they are the same one as yours.
Okay, I don't know that either. One thing you could try, have you tried copying those 200 drugs, like copy and pasting into like Word and then printing that out?
Oh, I didn't think about that. I should
do that.
You could
try that, and if it doesn't allow you to do that, then maybe you could ask tech support because it might just be something, a setting in your computer, you know, that's personal to you that's not letting you do it. But you can try the copy and paste, but some books and e-text won't allow you to copy anything, but some do. So try that and let me know what you find out.
Okay.
So we always have a knowledge check every week, and you have to go through the reading for this. It will ask you to load the Unit 1 knowledge check in a new window. Let's see if it will let me do that. Okay, it's not going to let me because I'm not like actually a student, but when you click on it, it will allow you to load it into a new window, and it will go through the reading, and you have to answer questions from the reading to get credit for it, and it's a 10-point kind of a little assignment. All of the answers are right there in your reading, so you should be good to go. It's no quiz that you have to like memorize anything for. Everything is right there for you. You just read and answer questions. Okay, so every week we have a discussion, probably just like your other courses. We have a topic, and then there's usually a video or some sort of an article or something like that related to the discussion that you have to watch. So, and then you're going to post your response. So see here, people have already started posting. So you want to post your response into the reply section, and you need to do that by Wednesday at midnight. So tonight at midnight, your week 1 discussion initial post is due. Please make sure that your discussions are substantive. You don't want to just put a couple sentences or a small paragraph. You should be putting a good 2-3 paragraphs for your discussion. Answer all of the questions that it asks. Make sure that you're hitting all of these points. It always asks you to, in your responses, you want to make sure you state how this is relevant to this week's materials. So by the end of your discussion, make sure you're saying how this is relevant to what we're learning. So you're going to answer all of the topics, do your discussion. You're going to talk about how it's relevant to what we're learning this week. And then always post your references at the end of your initial discussion post. So right here, Naomi posted some references here. Here's another example. So just make sure that you are posting your references because that is part of the grading. So you want to make sure that you have that every time. If you don't have your references, even if you have like a super great initial post, I will have to like mark off 2 or 3 points. So make sure that you do that. And then you need to respond to at least 2 other students by Sunday at midnight. So you're going to have your initial post Wednesday at midnight and respond to at least 2 other students. When you're responding to other students, it needs to be more than great post or great job. You have to say something about their discussion. Maybe discuss what they said or talk about something that makes you that you think of from reading theirs, or maybe ask a question to further their discussion, something that shows that you're really responding to their posts and that we're interacting with each other. This is where we interact the most, so we want to make sure that we get the most out of this. You are more than welcome to respond to more than 2 people, but you are required to respond to at least 2 other students. If you do have to use any references in your response, so if you have to look up something or use an article, make sure that you post your references in your responses too. If you don't look up anything for your responses, then you don't have to post a reference for the responses, but you do for sure for the initial post. So make sure you always post everything. If in doubt, post it. That's what I say. Because you want to make sure that you're covering yourself from plagiarism and things like that. Do you guys have any questions about the discussion area? You're probably pretty used to it by now since you guys are near the end of your programs. Any questions?
No.
Okay, great. Okay. And then the last thing we have for this week is an assignment. And I have a little PowerPoint I made up for that. So Unit 1 assignment, microbial and non-microbial presentation. So for this assignment, you're going to create a PowerPoint and you're going to talk about microbial diseases and non-microbial diseases. So it says, for this assignment, you will complete research using scholarly sources, so you are going to have references, to locate and discuss 2 different diseases. One disease example must be of microbial origin, and the second example must be of non-microbial origin. So I'm going to discuss the difference between those 2. But in your PowerPoint for each disease, you want to talk about the pathophysiology of that disease, like where does it come from, what is it made of, the prevalence, like how often does it occur, like right now COVID-19 is all over the place, so it's very prevalent. The etiology, like where it comes from, clinical manifestations, how is it made up of? Is it like a bacteria, things like that. And you'll find all this in your research. The diagnosis of this disease and a treatment. Are there medications you can take to treat it? Things like that. You want to make sure you have PowerPoints, you include a title slide, include images that might help represent. So if it's like a bacteria, you can find an image and stick it in your slide. It says use the notes area of the slide to use as speaker notes or script. I'm not too particular on this. You can just jot some notes down in the slide if you like. I mostly am looking at your slides though, so that's where I'm going to concentrate my efforts in grading. You want to have a minimum of 13 slides. So you should have a title slide, 13 slides for both of your diseases, so 13 total for 2 diseases. And then you want to have a reference slide, or however many slides you need to post your references. So 13 slides should be plenty to talk about both diseases. So that gives you about 6 slides per disease, 6.5 slides per disease. And that way you can talk about each one. So each slide, do 1 slide for pathophysiology, do 1 for prevalence, do 1 for etiology. So that way you can use up your slides. In this assignment and in all of our other ones, we've got a rubric. So it will show you here how I grade for that. So you see here in the rubric, it has each section. So you don't want to miss any sections. It has prevalence, etiology, clinical manifestations, diagnosis, treatment. So you want to make sure you cover everything. Okay, does anybody have any questions about this? I am going to do a small PowerPoint lecture over those microbial and non-microbials, but do you have any questions about how to set up your assignment?
No, ma'am.
Okay, good. Okay, so let's look at my PowerPoint. Okay, so you probably already know what microbial and non-microbial diseases are without even knowing that you know it. Microbial diseases are basically any bacteria or microorganism, let me go back here real quick, like viruses, fungi, protozoa, so anything that is microbial in nature that you can catch. So if you get in contact with a bacteria, That's a microbial disease. Viruses, like the cold virus or COVID, that's a microbial disease. Anything you can catch, basically, that's how I remember. So bacteria are microorganisms that invade the body through air or touch. So these are some bacterial examples. Coughing and sneezing you can catch it through coughing and sneezing. Coming in contact with infected people through kissing or sex. Contact with contaminated surfaces, food, water. Contact with infected creatures, including pets, fleas, ticks. It can be anywhere. So what are some examples of a bacterial microbial disease? Strep throat, H. pylori, any staph infection, bacterial meningitis, gonorrhea, which is an STD, anything like that. And with bacterial microbial diseases, we treat those with antibiotics. So anytime you get a bacterial disease, it's treated with the antibiotics. The other examples are viruses. These are very similar to bacterial infections in that you can catch them in the same way. They're in the air, coughing and sneezing, kissing, sexually transmitted, surfaces, livestock, fleas, ticks. The only difference is that they're viruses instead of bacteria. So examples would be the flu, influenza, COVID-19, the common cold, HIV, viral meningitis. So viruses cannot be cured. They can't be cured with an antibiotic because they're not a bacteria. There are antiviral medications out there that can help shorten the duration of the virus. So for like influenza, if you come soon enough after getting symptoms, you can get prescribed Tamiflu, and that can help shorten your virus, but it's not going to cure it. Viruses just have to kind of live out their life and then they go away. So for the common cold, it can be anywhere from 10 to 12 days or more. You guys know you've had some colds that are over in like a day or two, and then you have some that last for like weeks and weeks. It just depends on the virus and how it lives in your body. So fungus, that's another example of microbial diseases. So a fungus invades the tissue and can cause a disease that's confined to the skin, spreads into tissues, bones, organs, and can affect the whole body. It depends on the affected area, but it's usually some sort of a rash or a vaginal infection or something like that. So some examples: athlete's foot, candidiasis. I always have a hard time saying that word. So that's like thrush. If you guys have children, your baby probably had thrush. All of mine did at one point. Ringworm, fungal eye infections, yeast infections. So fungus is also a microbial disease. We treat these with antifungals. They're usually in cream form. Sometimes there's pills for those, but usually we have to apply a topical cream to get rid of that. And then finally, protozoas for microbial diseases. These are microscopic one-celled organisms that can be free-living or parasitic in nature. So protozoas are parasites. They're like the grossest microbial. It creeps me out, the protozoas. But they are able to multiply. So things like tapeworms, heartworms, things like that. So they get into humans and their survival permits serious infections to develop and things like that. They can live in the human intestines or occur through fecal or oral route. Dogs and cats are often tested for heartworms and worms in general in their fecal matter because it's a common thing they get because they're constantly smelling and around fecal matter. Some examples would be malaria, toxoplasmosis, tapeworms, heartworms. And these are usually treated with a anti-protozoal medication. So it's usually some sort of a pill that you would take that kills any of the parasites living inside the person or pet. Okay, so those are the 4 types of microbial diseases. So when you're doing your assignment, you can pick a bacterial infection, you can pick a viral infection, you can pick a protozoal infection, or a fungus infection. It's up to you. Microbial is a lot less information, or non-microbial, sorry, is a lot less information. So non-microbial diseases are things that you can't catch. So they're non-communicable diseases. It's not transmissible directly from one person to another. So examples would be Parkinson's disease, autoimmune diseases, strokes, heart disease, cancers, diabetes, kidney disease. So basically, people that get these diseases don't catch them from somebody, they develop them, whether it's genetic, whether it's poor lifestyle, you know, it kind of just depends. So a non-communicable disease is a non-infectious health condition. It cannot spread from one person to another. So if somebody has Parkinson's, you can still go around them, you're not going to catch it. It lasts for a long period of time, and it's known as a chronic disease. So a combination of genetic, physiological, lifestyle, and environmental factors can cause these diseases. Some things are unhealthy diets. Obviously, if you don't eat healthy for many, many years, you could develop heart disease. Lack of physical activity, smoking and secondhand smoke, excessive use of alcohol, things like that. So sometimes it's bad luck and it's genetics, and even if you live the healthiest lifestyle ever, you might develop lupus or rheumatoid arthritis or something like that, but sometimes they can be prevented by living a healthy lifestyle. It just kind of depends. So do y'all understand the difference between microbial and non-microbial? One you catch from something, one you don't catch, and it's non-communicable. Any questions about that? So for the non-microbial, you can pick anything. You can pick Alzheimer's disease, kidney disease, cataracts, lupus. There's tons of them. So just pick one of those for your example and talk all about that one. And there's my references just to give you an idea. Okay, so that's all you're going to need to know for your assignment. Let me go ahead and close this. Okay, so let me make sure that's it for week 1. So that's all we've got for week 1, your 10-point knowledge check, your discussion, and your assignment. Your assignment is due Sunday at midnight. So all assignments and knowledge checks and quizzes or exams are always due Sunday at midnight. Discussions are initial post Wednesday, 2 student responses Sunday. It's going to be like that every week. Okay, I'm going to stop sharing. Okay, so that's all I have for the course so far, and that's all I have for week 1. If you guys have any questions, just let me know, okay? I'm happy to help. If you need any extra tutoring or anything like that, I'm happy to help as well. Any questions so far?
No.
Okay, great.
No, ma'am.
All right, well, I'm gonna let you guys go for today. Please reach out to me if you need anything, and have a super week. I'll see you probably next week on Wednesday.
All right, you too.
Thanks.
Do we, I
Bye.
have a question. Do we need to be back in Zoom next week at the same time?
I'm gonna always do them on Wednesdays at 11, but if you can't make it, I'm gonna be posting the recording every week. So you can always listen to the recording as well.
Okay, thank you.
Okay. All right, have a great day, guys.
You too.
Thank you.
Bye-bye.